Your head is pounding. You reach for a small white pill, swallow it with water, and within an hour the pain is gone. You don't think twice about it. You've done this dozens of times. But here is the thing. That moment of relief you just experienced took humanity roughly 10,000 years to figure out. And the road to get there is far stranger than you could imagine. Headaches are not a modern problem. They are not caused by screens or stress or bad posture. They are one of the oldest, most universal experiences in human history. Every human who has ever lived has felt that pressure behind the eyes, that tightening band across the forehead, that deep throb at the base of the skull. Your ancestors felt it too. The question is, what did they do about it? The oldest written record of a headache treatment is over 3,500 years old. It comes from ancient Egypt. The Ebers Papyrus, a medical scroll discovered in 1873, describes a remedy for head pain that involves binding a clay crocodile holding grain in its mouth to the head of the sufferer using a strip of fine linen. The crocodile represented the god of disease. The idea was that the god causing the pain would be distracted by the offering and leave the body. This was not superstition to them. This was medicine. This was the best answer they had. But go back even further. Long before writing, before Egypt, before civilization as you know it, your prehistoric ancestors were already trying to fix head pain. And what they did might be the most extreme medical procedure you have ever heard of. They drilled holes in each other's skulls. The procedure is called trepanation, and it is the oldest known surgical practice in human history. Archaeologist John Verano spent decades studying skulls from Peru, France, and Russia, some dating back over 9,000 years. Many of them show clean, deliberate circular holes cut directly into the bone. And here is the part that should stop you cold. Many of those skulls show signs of healing around the edges of the holes. That means the patients survived. They lived for months or years after someone took a sharp stone tool and carved an opening into their head while they were alive and awake. Why would anyone do this? The leading theory is that prehistoric people believed head pain was caused by evil spirits trapped inside the skull. The hole was an exit, a door for the demon to leave through. You might laugh at that. But pause for a second. Your ancestors had no concept of blood vessels, neurons, or pressure. They had the same brain you have, the same intelligence, the same drive to solve a problem. They just had none of the knowledge you have been handed for free. They looked at a person writhing in pain with an invisible enemy inside their head, and they reasoned their way to a solution that actually, sometimes, worked. Because if the headache was caused by a brain tumor or excess intracranial pressure, drilling a hole genuinely would have relieved it. They were not wrong by accident. They were doing the best science available to them. Move forward a few thousand years to ancient Mesopotamia. The Sumerians had a different theory. They believed headaches were punishment from the gods. Specifically from a demon called Humbaba, who was thought to squeeze the head of sinners from the outside. Their treatment involved elaborate rituals, spoken incantations, and the burning of specific plants. One of those plants was cannabis. Another was willow bark. You have probably heard of willow bark before, but maybe not in this context. Willow bark contains salicin. When your body metabolizes salicin, it converts it into salicylic acid. In 1897, a chemist at Bayer named Felix Hoffmann synthesized a more stable version of salicylic acid and called it aspirin. The Sumerians were using a cruder version of aspirin over 4,000 years ago. They had no idea why it worked, but they knew that it did. This is the pattern you start to see everywhere you look. Ancient cultures stumbling toward real solutions through observation, ritual, and trial and error, even when their explanations were completely wrong. The ancient Greeks moved the conversation forward. Hippocrates, writing around 400 BCE, was among the first to argue that headaches were not supernatural at all. He proposed they were physical events happening inside the body. He described what we would today recognize as migraines with remarkable accuracy. The visual disturbances before the pain, the sensitivity to light, the nausea, the one-sided throbbing. He had no MRI machine. He had no neuroscience. But he watched enough patients closely enough that he mapped a pattern that doctors still use today to diagnose migraine. His treatment was willow bark tea and rest in a dark room. Two of those three things are still recommended in 2025. The Romans added their own chapter to this story. Roman physician Aulus Cornelius Celsus documented a treatment for severe head pain that involved placing an electric torpedo fish, what you would call a torpedo ray, directly against the forehead of the patient. The electric discharge from the fish was thought to shock the pain out of the skull. This sounds absurd, but the underlying principle, using electrical stimulation to disrupt pain signals in the nervous system, is the exact mechanism behind transcranial magnetic stimulation, which is an FDA-approved headache treatment today. The Romans had the right idea wrapped in the wrong understanding. Move to medieval Europe and the treatments become darker. Headaches were once again attributed to demons and divine punishment. Monks documented rituals involving the pressing of a hangman's rope against the forehead. The logic was that the rope had absorbed the death energy of a condemned criminal and could transfer that power to drive evil from the head. Garlic was tied around the neck. Red strings were wrapped around the wrist. Holes were still being drilled in skulls. Across different cultures, across centuries, the same desperation to fix the same invisible pain kept producing the same reaching in the dark solutions. In ancient China, a completely different model was emerging. Chinese medical texts dating back to the Han Dynasty, roughly 2,000 years ago, described headaches as disruptions in the flow of qi, the body's vital life energy, through invisible channels called meridians. The treatment was acupuncture. Thin needles inserted at specific points along the head, neck, and hands to restore the flow. Today, over 2,000 years later, clinical trials published in journals including the BMJ and JAMA Internal Medicine have found that acupuncture provides statistically significant relief for chronic migraine sufferers compared to placebo. Neurologists still debate exactly why it works. The ancient explanation of qi flow is almost certainly wrong, but the outcome it produces appears to be real. Something is happening at those needle insertion points that reduces pain. We do not fully understand it yet. In India, Ayurvedic medicine offered yet another framework, the Charaka Samhita, one of the foundational texts of Ayurveda written around 400 CE, categorized headaches into distinct types based on their location, their quality, and what seemed to trigger them. This is almost exactly how modern neurologists classify headaches today: tension headaches, cluster headaches, migraines, sinus headaches. The ancient Indian physicians were pattern matching the same phenomenon with the same observational rigor, just without the tools to look inside the skull and see the cause directly. Their treatments included sesame oil massaged into the scalp, steam inhalation with medicinal herbs, and dietary restrictions. Interestingly, several of the herbs used, including Brahmi and ashwagandha, are now being studied in clinical settings for their anti-inflammatory and neuroprotective properties. The mechanism is modern. The plant is ancient. Honum. And then something changes. In 1868, a British physician named Edward Wokes noticed that ergot, a fungus that grew on rye grain and had been used in folk medicine for centuries, seemed to constrict blood vessels in the brain. Ergotamine, derived from ergot, became one of the first targeted headache medications in the modern era. By the late 20th century, a class of drugs called triptans was developed specifically for migraine, targeting serotonin receptors to interrupt the pain cascade in the brain. These drugs work on a level that would have been completely invisible to every single healer in this entire story. Receptors on neurons, neurotransmitters, electrical signals firing across synapses 100 times per second inside your skull. The Sumerian burning willow bark in 2000 BCE and the chemist synthesizing aspirin in 1897 are both part of the same story. The prehistoric surgeon drilling a hole in a skull to release a demon and the modern neurosurgeon drilling a hole to relieve intracranial pressure are both part of the same story. The Roman physician pressing an electric fish to a forehead and the neurologist delivering transcranial magnetic stimulation are both part of the same story. It is accumulated knowledge, passed forward generation by generation, tested and refined and passed forward again, until it arrived in a small white pill sitting in a cabinet above your bathroom sink. Tonight, when your head starts to throb, you will reach for that pill without thinking. But now you know, it took the entire span of recorded human history to put it there.